Hey, Care Partners, Teresa Youngstrom, glad you're back. Hey, we've got a great day planned for you today. We're always trying to find new avenues of information for you. And today it's not just me. I'm excited to tell you we have a wonderful speaker from Mount Lookout Chiropractic in Cincinnati. And I'm excited to get started with Steve King. Let me read his bio, it's really impressive. Dr. Steve King graduated cum laude from Life Chiropractic College. He treats a wide variety of musculoskeletal conditions and sports injuries. He works with many professional athletes and amateur athletes, enthusiasts to treat and prevent injury, as well as enhance their performance. Dr. Steve has an extensive postgraduate education in chiropractic, and he has a master's degree in human nutrition. His comprehensive approach includes a state of the art chiropractic care, targeted nutrition protocols, and exercise recommendations. Dr. Steve also holds a Bachelor of Science degree in mechanical engineering from the University of Florida. Prior to his chiropractic career, I was always impressed by this. Dr. Steve worked as a space shuttle engineer at NASA's Kennedy Space Center in Florida. So, thank you and welcome, Dr. Steve King.
Good afternoon.
Hey, how are you today?
Very good, very good.
Good. We're so excited to have you here. We're heading into our second year with podcast, and just such a pleasure to have new and more interesting speakers. As we reach out there, it's so exciting. So thanks for taking time out of your busy day. I know you see a million patients a week, and because I've been in your office several times, and actually I trust my chiropractic care to Dr. Steve too. So you all should know that. And it's one of the first places I go when I have injury or discomfort or something. I think chiropractic care is fantastic. So when we talked about maybe coming on the program, when I heard what else he knows about how our fields can cross over each other, I just knew he had to come on the podcast. So let me get to the questions. Let's get started.
Well, thank you for having me.
Yeah, for sure.
It wasn't a million patients, but it was quite a few.
Close to it, I think. Okay. You've mentioned on numerous occasions that chiropractic would be best in the arena regarding dementia/memory care prevention. Why do you say that?
So the thing with chiropractic is that it's kind of a holistic therapy. It's our primary treatment is what's called a mechanical adjustment or a chiropractic adjustment, and that is one aspect for treating back pain and musculoskeletal conditions, but it also helps with performance and movement and just feeling better. So as a chiropractor, I'm licensed and trained to do the chiropractic adjustment. But we're also allowed to, or within our practice scope, our scope of practice, we're allowed to do nutrition and supplement recommendations. And we can also train people and advise people on exercise. So it's a holistic approach. We can also get into diet, and that goes with the nutrition. So there isn't a clinical study out there that says if you do a chiropractic adjustment, you will prevent or you will end or reverse dementia or Alzheimer's or Parkinson's. So the reason I really stress the prevention is if I can get someone when they're younger, like even when they're in their teenage years, and I can educate them on chiropractic treatment and exercise and diet, then theoretically we could prevent a lot of conditions, and neurodegenerative conditions is what we're talking about today. We could actually prevent neurodegenerative conditions by following some of the current literature that is out there.
Absolutely. And I know we've talked about nutrition in the past too. And I work with a lot of Parkinson's residents, patients, clients, and boy, it's move it or lose it. And they really, really need this.
So with Parkinson's, the huge cause of Parkinson's is environmental factors, and air pollution. I actually dug up a study that actually the premise of the article is that Parkinson's could be completely prevented if you address the environmental factors. And they actually did a study on Camp Lejeune, I think is the name of the Marine camp in North Carolina. Am I saying that right? Camp Lejeune.
Hmm.
But anyway, there was they had problems with their well water, and it had polyethylene in it, and they linked the polyethylene in the well water to the cause of Parkinson's disease. And they actually did a study comparing Camp Lejeune in North Carolina to another Marine camp in California, which had totally different water. And the people in Camp Lejeune, North Carolina, had much more prevalence of Parkinson's disease.
Wow. It's
So it's
scary to
kind of,
think. Yeah.
yeah.
Scary to think
And,
that we're just getting it from the water.
and so like polyethylene is in dry clean, if you get your clothes dry cleaned. And it can, if you don't get your well water, if you drink well water and you don't get your well water tested, it could be in the well water. So the dry, so again, that's an environmental factor that you could prevent if you know about it.
Exactly. No, I love
So,
that. We need to know about it for sure.
yeah.
Well, why isn't chiropractic treatment utilized more in the arena of, say, dementia, memory care, or, mental health for that matter?
Well, I mean, I think it's awareness is probably the biggest thing. People don't, and so most people think of chiropractic care for back pain, low back pain, and neck pain, and they don't even realize that we can help tremendously with extremity pain and ankle pain and shoulder pain, wrist pain, all that, anything in the musculoskeletal system. So again, it's an education thing. I think if I won the lottery today, which I'll probably will try, because there's always hope. I'm just kidding. But if I won the lottery today, I would immediately set up studies to correlate and provide proof that chiropractic can do this, or manipulation can do this. And so it comes to, anyway, back to the awareness thing. Yeah, they're just it's purely awareness. So
Yeah, and in my work, being able to set up routines early on with the person that you're loving through dementia, if part of their routine was coming to see you once a week, it would be so awesome. I would love that. And that's just part of their routine. They're familiar with it, so it doesn't seem foreign and therefore they're not afraid. And so I
right.
would I would love that if they were all coming to see you once a week. Okay. What do you think's the
So
most Go ahead.
but with that, so I started to go down a rat hole with studying so neurologically, when you do an adjustment, a manipulation, a chiropractic adjustment, what happens to the body? And then I started going down a kind of a rat hole preparing for this podcast, because there's a lot that happens neurologically. Um, and so if you have a patient that currently has dementia, then that's more advanced than someone that doesn't, right? They have
Absolutely.
kind of hardwired their system, and they are kind of they've had a lot of stuff that's kind of ingrained, or I call it hardwired. So the idea of preventing that would be to get the person when they're younger and adjust them all along and keep their spine and their joints moving better, so it doesn't get to the point of the advanced, even early onset dementia has a lot of musculoskeletal symptoms and problems. So anyway, I started to go down the rat hole of studying what happens with the neurology of an adjustment. And I'm not going to do that to you today, but it is a known fact, a physiological fact, that when you do an adjustment, you stimulate certain parts of the nervous system, and one of them is the limbic system, and the limbic system is housed in the hippocampus,
Absolutely.
and your hippocampus is the primary center that gets altered or starts to neurodegenerate in these the dementia type cases and Alzheimer's.
Yeah. And then that's where our short-term memory,
It's short and long
deteriorates.
term. Yeah.
Yeah. And so
So
then we can't process those thoughts into long-term memory. I tell people it needs to be sticky in there. That hippocampus needs to stay sticky, and we need to hang on to those thoughts. So at night they will go to your long term. And that's a huge challenge. No, I love that. And if people out there, if you've never had an adjustment from a chiropractor, let me tell you, do some research on that and find somebody. And I think it's a game changer. When you got a little ache or pain, you know what? I really usually figure out, oh, my knee was acting up, my hip was acting up, my ankle was out acting up, and it throws my body out of alignment. And then I'm just such a believer in chiropractic care. So thanks,
Well,
Steve, for what you do. um, Let's see. Let me check my questions here. So, what do you think is did I already ask you that? What do you think is the most important underlying cause? We talked about environmental. Well, ignoring genetic
yeah,
predisposition,
yeah.
you think you
So
really
the
answered that
yeah.
already.
Well, I talked about the environmental factors, but so a lot of people like the ApoE4 gene for Alzheimer's,
Mhm.
they think, okay, if I don't have that, then I'm okay. And I wish that was totally true. But so when you say environmental factors, it's certainly air pollution and water quality. But then what else? So that's a whole nother it's a very exciting, fun topic. And because you get with environmental factors, you got to include how you sleep, sunlight, nutrition,
Mhm.
social connection,
Yeah.
hydration. So that if said to me, well, I want to know 5 things that I can do today, then I would be able to help you with that, and not only in treating it, but ideally preventing it. And that's kind of the premise of our meeting today. Really, is that the
Yeah.
idea of listening to someone that. So, for example, when you get up in the morning, if you can, when you get up and and this goes for anybody, when you're done sleeping, and ideally you would sleep 6 to 8 hours, you get sunlight as soon as possible. And that sunlight is really important in stimulating the proper hormonal balance, and especially what's called cortisol. Now, the nutrition, the quick answer on that is you want to minimize processed foods.
Oh my gosh.
Ideally, all of your food would come from unprocessed, or from organic, all natural things that aren't on the shelf. So it's either in the refrigerator or you pick out of the earth, or so that's ideally it would be 100%, but you can't always do 100%. So um, and so I think I covered that. And of course, we can spend hours on exercise and movement. Um, and then, people, the social connection is a whole nother subject. And
Mhm.
then hydration. You wouldn't believe how many patients I have that I try to get them to do some kind of way to increase hydration, and not just say drink water. I try to get them to do a low sugar or no sugar electrolyte type drink that they'll drink water with lemon. So I could go on. I think I've digressed a little bit, but
Well,
you want to get
but
me
you're
back
right
on
on
track?
track. You're right on track, and if we actually start going down that path even further, if we really evaluate all the pills they've been put on by the time
Hmm.
they're at, my age and above, and, we really evaluate all the side effects from all those things, and, which one of those is, decreasing their salt or decreasing this, and so wow, there's just so much to nutrition, Steve. And I'm just excited that I might be on the neurological, end of that and the dementia and everything, but yours is very broad, what you're able to
Yeah,
do. And nutrition is a huge factor. People, we can't just take the pills and not change your diet. Can't do it with diabetes. You can't do it with
yeah,
these other diseases. And so I've been told once we're supposed to shop the outer aisle at the grocery store.
yeah,
Don't go into the shelves, and,
yeah,
that's where all the processed stuff is, and they make those things to tempt you and to be addictive and all those things, and we really need to think twice about what we're putting into our system, me included. I'm not perfect about that, and so but we do try and eat clean as much as we
yeah,
can and eliminate sugar from the diet, so, we're gonna lose some folks with that, so I'm afraid, so
yeah.
let's get
That's
back on course here. Um, You mentioned there's a connection between cardiovascular disease and the musculoskeletal disease. That is well established. Okay, so is there a similar connection between memory loss and or dementia?
And so, the current premise is that yes, there is, and it's just some of the literature research I did preparing for this podcast. Even they all came back. The different papers that I read all circled back to low glycemic was a key word. So low sugar. So Mediterranean diet.
Mhm.
Even in the Alzheimer's world, the ketogenic. So ketogenic is
Absolutely.
the it's a more of a, so it's a low sugar quality protein, quality fat diet. Um, they the bottom line is lots and lots of vegetables, just tons and tons of vegetables, and then healthy fat and quality protein. Ideally, of course, wild caught, grass fed, those key terms. And it's hard to get that all the time. It's more expensive, but if you can, I think I would say that the connection, and from what I've studied and what I've learned and different things that I've done, and I don't necessarily have a paper to prove this right this second, but I think the connection between the dementia, cardiovascular disease and musculoskeletal disease is the high glycemic
Mhm.
foods. So if you can keep your blood glucose and fasting insulin at a stable level all throughout the day, it's like it should be everyone's mission to
Mhm.
never let your sugar, which means, so if you intake a lot of sugar, you'll spike insulin. If you never allow your insulin to spike,
Mhm.
then you have a extremely high chance of preventing a lot of problems, because insulin is increased insulin for long periods is very inflammatory, and inflammation, of course, you could say this for anything, but inflammation is the driver of all disease, and it's really the chronic sustained inflammation. So if you're constantly spiking your insulin throughout the day, then you're going to be somewhat inflamed all day, because your body's got to recover from that spike. And
Right.
so, I wish I could say that, you really, ideally, you just wouldn't eat sugar. I mean, it's just it's that simple. And then, but you also got to be aware and be educated. And that's where chiropractic can shine. That's where you can shine, Teresa, as a nurse practitioner, coaching people on what causes those spikes in sugar, and actually ultimately on insulin.
Yep. And
There's my
everything I'm reading is really concurs with that, that I'm
yeah.
seeing more and more push towards more of keto, intermittent fasting, and they're calling Alzheimer's or dementias, like type 3 diabetes, because they're seeing such a correlation with the hyperinsulin and becoming insulin resistant. But I'm sad that I'm not sure we're in the majority of teaching that the diet is so important. But when I have people telling me about foggy brain,
Mhm.
and the new onset of like a foggy brain, I do want to look, what are you eating and what might be causing that? And are you at least pairing your carbs with a good protein, to limit maybe how high that glycemic reaction is? Um, but a lot of times, and I understand at a certain point, you know what? It's about comfort care and symptom management,
Yeah.
and I get it at a certain point. But if we're still let's back up, let's roll the camera back to the point where we're still trying to prevent things, because we see what the statistics are. So why wouldn't you? Why wouldn't you start, Mediterranean diet, or maybe if your doctor agrees with that, intermittent fasting, things like that, to try and help yourself avoid
Yeah.
this huge river of people that are developing brain failure. So I agree 100%. Let's see. What's the number one lifestyle habit you would advocate for the prevention of memory loss and early onset dementia and Alzheimer's, what would be your number one lifestyle habit?
So, and I did think about this question a lot. So I think the best hack, I don't know if you know what I mean by that term, the hack to prevent something or to keep from getting something, whether it's cancer or Alzheimer's or, type 2 diabetes, or name something. The best hack right now, I would say, is exercise. And so, Peter Attia talks about this in he's a medical doctor that wrote a book called, I think it's called Outlive. And he talks about, he thinks exercise is probably the number one hack. So I got that from him.
Okay.
And then also another great guy to listen to is Andrew Huberman. He does Huberman Lab podcasts, and he talks about exercise in all kinds of different episodes. So he's a great resource. So, and again, it comes back to the theme of our podcast. I always like to have like a plot or a theme of whatever I'm doing, whether it's a talk or a speech or just teaching a class on whatever it is. I think the theme of our day today is prevention. And so if you can get adjusted and move properly and exercise moderately, then you have a chance just with that alone to prevent neurodegenerative conditions. So that's the hack.
Absolutely. I think you're spot on. I think this has been so great having you on the podcast today, Steve. We might have to do a part 2 sometime. I do have to correct you. I'm not a nurse practitioner. I am a registered nurse, but I like the title, but I am a registered nurse.
That's very commendable. And I think all registered nurses are going straight to heaven. So there you go.
Well, I appreciate that. Hey, I got to give a shout out to Mount Lookout Chiropractic Care. Hey, if you're in Cincinnati, you need to look up this organization. Steve, can you just elaborate on what other services you can get there? Because I've had massage there. I've had, all kinds of different treatments there. Tell them a little bit more about Mount Lookout Chiropractic while I have you.
Okay. So we've been in practice now. The practice has been in business now for 35 years. And so we treat all types of musculoskeletal conditions. So you can get chiropractic care. We have a full physical therapy department. It's in a different section of the building than our chiropractic, but we have full physical therapy. We have 2 physical therapists and a physical therapist assistant. We have a full-time functional medicine doctor. She's actually a chiropractor. Her name is Rebecca Furlano, and that's what she does. Her primary focus is nutrition and functional medicine. And then we have different chiropractors do different things, and we all kind of like specialize in different things. I tend to treat professional athletes, what we all do. And so we can work with athletes, we can work with teenagers. We have what's called dry needling, which is a type of, the needles are like acupuncture needles, but they're more of a focused section. Several of the chiropractors here at the office do that. We do different soft tissue techniques. We do not do massage anymore. We just recently added what's called a stretch. We have a stretch lab or stretch station where we will spend one of our employees will spend a half hour just doing stretches. And I think I got everything.
Well, that's
Did I
quite a
miss
bit.
anything?
It's quite a bit. And I appreciate the practice. And I know you see a lot of folks in our area. So be sure and check that out if you're not familiar with Mount Lookout Chiropractic. All right, guys. Thanks for another great day. Thanks, Steve. This was really wonderful. I learned a lot, and I'm sure that the listeners learned a lot too. So
Thank you very much.
yeah, absolutely. Hey, everybody. Thanks for being here today. Remember to like and subscribe. And share this with someone because there's someone you know that needs to hear this information, or check out the podcast, whether it's on YouTube, Spotify, and honestly, the web manager's putting them right on the website for you. So you can find it there at teresayoungstrom.com. You know how much I care, you guys, why I do this. And always remember, you got this.